Good morning, everyone. We will get started in just a few minutes. There's still a few more people planning to join us. So if you could just wait until 8:02 or 8:03, we will begin then.
Hello, everybody. Thank you very much for joining our second informational call on the Illinois CHIPRA Patient-Centered Medical Home Asthma Learning Collaborative. This is Kathy Sanabria. I'm Associate Executive Director with the Illinois chapter of the Academy of Pediatrics. And I have here with me also Scott Allen.
Good morning, everyone. I'm Scott Allen, Executive Director for the Illinois Chapter AP.
And we also have Drew O'Rourke with us. She's a manager, and she's also helping us to coordinate this activity. So we're going to go ahead and get started. This is our second informational call. We're really excited to have 19 people registered for the call. We also had an informational call on January 14th, which was very well attended. So we're excited that there's a lot of interest for this particular project. So we're going to move on to our next slide. All right, so we're just moved forward. Again, I want to give you a little background information. So this is a quality demonstration grant project. Illinois and Florida submitted a grant back in 2010, and we've been working on this through the Children's Health Insurance Program Reauthorization Act. And it's a project that's being implemented to enhance medical homes for children, especially those enrolled in Medicaid or the All Kids program here in Illinois. We're entering our 5th year of this grant. So it begins in February and it runs through January of 2016. And we've been working with this project with a group of practices. We had 59 practices enroll in Illinois in the CHIPRA medical home activity. And in the earlier years, we were working with a few learning groups, and we had many different activities that people could select from to help develop their medical homes. And as we enter our final year, we have decided, with the help of the Department of Healthcare and Family Services and with Health Management Associates, to pursue a more robust and more structured learning collaborative opportunity. And so that's what we're doing today. If she could give us some of her thoughts regarding the importance of the medical home model and how she's been able to utilize it within her own practice, which is Uptown Pediatrics. And also, Dr. Belvin is familiar with some of our projects that we've been able to do through the chapter, and she has participated personally and along with her practice as well. So, Barb, if you could just give us some comments.
Sure. So, you know, I'm associated with Lurie Children's Hospital, but run the medical home in Uptown, and have been working over the past few years with ICAP to improve our medical home. And I'm sure I'm not saying anything to anybody that they probably haven't already started working on, but I can say that I have found it really beneficial working within the structure of ICAP as well as other organizations in order to try and work on some of these principles and to create concrete improvement. So one of the things that we did with ICAP in the past 2 years, you can correct me, Kathy, if I'm off, but we have already worked on one of their projects with them called transitioning of the medically complex, and we were able to take our patients who are medically complex and create a registry, create a transition policy, create a skills list, and have improved communication with adult providers that I don't think we would have managed to accomplish all on our own. So it was extremely helpful having that structure and having ICAP staff help us along the way, as well as being part of a learning collaborative with other medical homes who are trying to accomplish the same thing we were doing. So we were learning from the other medical homes at the same time. The other major benefit that I would say we got from this is all the doctors also were able to get, and I don't mean to get ahead of myself, but we're able to get MOC Part 4 credit for this, and I've just finished recertifying, so that was clearly a benefit to me and was part of what allowed me to recertify. I don't know if you want me to speak about asthma specifically. We're already at this point working on some quality improvement in asthma through another structure. And again, I found the learning collaborative and a structural backbone to be very helpful in getting us to keep going forward with our process, so that we now have an electronic asthma control test that we do. We have electronic asthma action plans, and I would just say we found this of great benefit to us.
Okay, so great. That's wonderful, Barb. Thanks for giving those comments. And I think our sound is going quite well, so we will not have to mute your line, Barb, and you should feel free to contribute as we go along through the slides if there's anything you want to add based on your experience. So, okay, so now I just wanted to mention too that, again, this is a collaborative project with the Illinois chapter of the AAP, and also we're working with the Department of Healthcare and Family Services, and they're sponsoring the PCMH-Asthma Learning Collaborative. And we also have a partnership with Health Management Associates, so we have a lot of good staffing and support around this particular learning collaborative. So moving on to the next slide, I wanted to just talk a little bit about the goals for the project. And obviously we want to build a strong foundation for medical home and help the practices to make improvements. We organized the structure of this so that we're going to be working with one specific important condition, which is a chronic condition, and that's going to be asthma. And then we're going to be able to bring in the different components of medical home according to the PCMH standards and layer those on top of the work that we'll be doing. So we'll be focusing on ability to enhance access and continuity, help practices identify and manage patient populations, help practices to better plan and manage care, teach patients how to provide better self-care and access community-based resources. We'll be able to help with practices with learning how to better track and coordinate care, and also to measure what you're doing and to see whether or not a change that's been made is an improvement. So these are all things that we'll definitely be able to help you with. And then some of the other, specific things that we'll be working on are things that are familiar to most of you, and that would be trying to help the practices organize themselves so they are using a patient registry, that the practices are working in teams, so you would be setting up care teams around providers to improve patient care. And then of course we're going to be using the evidence-based guidelines, so that would be the NHLBI guidelines in this case. And then trying to help families and provide them with better care plans and family support. Another area we want to focus on is helping practices to work on emergency department and post-hospital discharge transitions, and trying to improve care coordination for those patients with the goal of trying to keep them out of the hospital and better manage their asthma care plans as time goes on. And then also we'll be working on coordination with specialists, medication reconciliation and adherence, and linking families to resources. And so, Barb, I wanted to ask, since you have already done some work in your practice on asthma, are there any other points that you would want to bring up related to those bullets?
No, I think these are the important ones, and I would also say, as I listen to this and I think of our experience when we went into our other project as well as the current asthma project, it sounds very overwhelming at times, but once one's doing it, it really isn't that overwhelming.
That's a good point. And we have done a lot of work already at the front end to really get this collaborative really well organized, and much more so than we've been able to in the past. So we have a lot of tools and resources already developed, things like change packages. We've already submitted our application to the American Board of Pediatrics to have this approved for Part 4 credit, so that's all in place. And as we go through the slides, we can talk a little bit more about those asthma measures that we'll be working on.
And the other point I would just make is that whenever one's doing a webinar like this one starting, as if these are all new things, but I have a feeling that a lot of the practices are already doing some of these things, and so that then ends up making transitions and quality improvements even easier.
Right. And for those of you on the call, I wanted to mention that we're going to go through the slides. There's not that many. The slides will be made available to you after the call, and then at the end of the call, well, not at the end, but after about 30 minutes of us presenting, we're going to open up the lines, and we'll be able to take questions from people who have specific questions related to the information we presented. So looking at the structure for this collaborative, we're going to be able to provide 2 learning sessions, so we will have them CME approved, and we're going to also be able to provide facilitation support to the practices. So we will be able to assign a facilitator to each and every practice that is selected to participate. And then we will be doing some data collection and sharing of that information with all of the practices as we go through the collaborative. It's going to, we have asked for the people who are interested to please complete an application to participate by February 7th. And we'll look at that timeline in a future slide. But then after that, we are going to have a subgroup of our expert our expert panel who is organizing this collaborative to review the applications and then select up to 20 practices to participate. And the practices will be notified February 21st whether or not they've been selected. So once the selection has occurred, we will be asking the practices to sign a memorandum of understanding. And in the materials we sent out for the informational call, we already provided an example of the MOU. So you have an idea of what that looks like. You can refer back to that. That was information sent out last week. But more importantly, once we get going with the collaborative, the work will begin in February and March. So we'll be doing some pre-work. And then we'll be holding our first learning session where we will be bringing the teams together from all the practices for our first learning session. And that will occur May 2 and 3. That happens to be Friday, Saturday. And then after that, we'll go back to our practices and do some work during the action period, testing changes. And then we'll bring everybody back together again for a second learning session to occur on Friday, August 15th. Then there'll be another action period, and then in November, the collaborative will end. So this is a time-limited project. It's over 10 months from February to November, and it's going to go rapidly, and we've learned over time that it's actually more beneficial to work with practices and try to teach them the model for improvement and working on PDSAs, doing rapid tests of change, rather than having months go by in between. It slows down progress. If we're well organized, we'll be able to fully guide you through the process, and it will not be overwhelming or cumbersome. So moving on to the next slide, we wanted to mention that all the assistance we're going to be providing is free. Each practice will be assigned a facilitator who will touch bases with you monthly to provide technical assistance support by phone and email. And then a facilitator will meet on site with a practice 3 times over the course of the collaborative. There will be an on-site visit that will occur prior to the first learning session to help the practices prepare. And then there'll be 2 more on-site visits to occur probably right before the second learning session and then after the second and final learning session. We do want to meet with the full team, and we're asking that your teams be set up once you've been notified that you've been selected to participate, and we're asking for the teams to fully participate in the learning sessions, and also we'll be able to provide many resource materials, including a comprehensive change packet that will have a lot of information about tools and resources you can use to rapidly move your practice forward. And we will be able to provide you with assistance for doing chart reviews, and we will be asking you to use SurveyMonkey for some monthly reporting back to us. Again, it will be very easy for you to use it, and we will be able to develop dashboards for each of your practices so you can monitor your progress over time and actually see what kind of improvement you're making. So at this point, I was going to just wrap up quickly about the benefits of participation, and then I'm going to turn it over to Scott. So again, the teams that come to the learning sessions will receive continuing medical education and continuing education credits. So those are credits that will be beneficial for not only physicians but also nursing and some other allied healthcare providers. We still have to apply for those, but we feel confident that we'll be able to get approval. We have already received MOC Part 4 credit for this Collaborative, and it's approved for 25 points for pediatricians. We will be able to also provide assistance in helping practices to achieve the Illinois Health Connect asthma bonus payment. And you'll be able to learn from your peers as you're going through this process. And that's really one of the greater benefits of the collaborative model. It's being able to work individually with practice teams and then learning from your peers over time. So now Scott's going to talk to, speak to the next few slides.
Good morning, everyone. I'm Scott Allen again, the Executive Director for ICAP. I'm going to cover a little bit of the process that we are proceeding with to enroll practices. So first, just in terms of eligibility, we do need the practices to be primary care located in Illinois, and they need to serve pediatric patients who are in Medicaid and all kids. We don't have a threshold, but we would like you to be an active participant in Medicaid, which I assume most of you are, so that's great. We need you to commit to the full 10 months. As Kathy mentioned, we are moving through this in a coordinated manner, and it will go fairly quickly, but we want everyone to stay with us for the whole 10 months. We'll need to designate a core team, and I'll talk a little bit more about that in a minute, but that would be a lead provider and 2 other staff, and then of course all the other practice staff are welcome to participate, but we really need that core team to be our contact. There are data collection requirements that Kathy touched on. So there are some chart reviews as well as medical home monthly reports, again, which we'll elaborate a little bit on in just a minute. And then you also need to identify a parent representative. You're welcome to, of course, identify more than one, but we need one to be part of the core team. We know that can be sort of challenging for practices, so we are willing to work with you to help and identify parents and give them specific guidance on their role as a parent partner with your quality improvement team. For some parents, it's a new role, but we have a lot of experience working with parent partners on quality improvement teams, so we're happy to help. And that we would need that person to be in place, hopefully with the application, but we realize it may not be firm, so definitely by the first learning session. We need you to have basic technology to be able to communicate and complete our online surveys. And then also, we are asking all the practices who enroll in this collaborative to register with the Illinois statewide provider database. This is a requirement and a commitment, but it's also a huge benefit. The provider database has a lot of great resources, which I think you'll all find useful, not just for asthma and other conditions, but for a whole range of things your patients are facing. So as Kathy mentioned, we have a timeline. We would like the practice applications to be completed online by Friday, February 7th. We will be selecting 20 pediatric and family medicine practices and notifying them later in the month. We will be reviewing the applications, and the applications, just so you're aware, are fairly simple. It asks for information about your staff, your demographics of your patients, very easy information, things you can probably just pull out of your records or your head. It asks for your core team members, so you need to be thinking about who that would be right now. And if you have a parent partner identified, we also want you to put that down, but again, that may be something we work with you to help confirm. And it asks a few questions about your readiness, your experience with medical home, things just I think you'll be able to answer in 15, 20 minutes. We are also going to hopefully get more than 20, and we will waitlist a certain number of practices who are not selected in case we can't confirm one during the first few weeks of the project. So please, if you are considering applying, we really hope you will put in an application. And you must be able to sign a memorandum of understanding simply to make sure you understand what you're committing to, that you're going to go through with all the data collection requirements and participate in the learning sessions. It's fairly simple, but it's really just a tool to help you make sure you understand what you're committing to and to guarantee with us that you will participate. I want to talk a little bit about the practice staff that we want to be involved. Again, we want a core team of 3. That would be a lead provider. We expected most lead providers will be physicians, but advanced practice nurses and other staff could also be the lead provider. And 2 other staff members, often another clinical staff as well as an administrative staff. The team needs to be at least 3. Some practices have chosen to add a few more people. And then depending on how many doctors, for instance, in your practice are getting the MOC credit through this project, there may be a lot of involvement with the rest of your staff. But that core team is really who we and the facilitator will be working most closely with. We need a parent partner to be recruited, as I've talked about. And then additional staff will be encouraged to participate in all the different tests of change you make, They'll be able to benefit from some of the learning session content. They'll be able to use pieces of the change package. So it's really something that we hope will spread throughout your practice, whether it's just one site or even a few sites in a system. And the expectations for that core team, as we've touched on, there's some pre-work. So getting together, understanding that you are the core team and what your roles are, completing the memorandum of understanding, identifying your parent partner, completing the baseline data, and we will be using the Medical Home Index Survey, which is a fairly simple tool, as well as providing us with some practice demographics and the first set of chart reviews, participating in orientation, kickoff call, participating in the site visit with the practice facilitator, as was mentioned. And then after we get into the project, there will be the 2 learning sessions. You'll have access to the facilitator and be able to work with them via email and phone, but also have them come in for site visits. And then the core of the work will really be testing those changes using your Plan, Do, Study, Act cycles. And again, we have tools and resources that will help you figure out what you want to try, how you can try it, how you can measure it. So the facilitator will work with you on all of that. There will be some monthly reporting as well as chart review data every 8 weeks. And then there will be group data sharing calls. As Kathy mentioned, we'll be able to provide you back feedback not only on your practice but on the whole collaborative, and you'll benefit substantially from talking to other practices involved in the project.
So very quickly, this is Kathy again. I wanted to go over just a little bit of information on the MOC Part 4 activity. So the expectations are for the pediatricians that will want to receive the MOC credit in 2014. We will be asking the individual pediatrician provider to conduct chart reviews and enter data of the last 10 pediatric asthma patients seen at baseline and then during the 4 data collection cycles. The cycles are every 2 months, and we set it up that way intentionally to allow the provider enough time to actually hopefully get enough, 10 charts of active asthma patients who will be tracked. And I'll go over with you in just a second what the 4 asthma measures are. But just very quickly, I wanted to mention, so the goal is for here, we really want to get as many of the pediatrician providers in each practice to participate in the collaborative and do the chart reviews. If we get more than 1 provider from a practice and you're having difficulty getting to 10 charts, for example, so long as we can get 10 out of a practice, we'll be in good shape for the MOC credit. And then if there's other providers who are within your practice that are participating for MOC credit, if they cannot get up to 10 because I haven't seen 10 patients during the 8-week period, we can work with you on that. Since this is a collaborative project, we have a little bit of flexibility in terms of what the chart review requirements will be. But at the very minimum, we will need at least 10 charts per practice and hopefully 10 charts per provider as we go through the data collection cycles. Don't worry about this right now. We will be reviewing this again later just with the pediatricians who are doing this for MOC credit. We also wanted to get as many of the providers to participate in the learning sessions. So even if there's 3 members on your core team, but some of the other providers or nurses in your practice are able to join us, then they're welcome to attend the learning session. And then our goals for improvement with regard to the asthma measures are we're looking for 25 to 50% improvement from baseline, and I'll talk about that in a minute. And then at the end of the collaborative, ICAP will take care of all the attestations so that the pediatricians receive their MOC credit. The 4 asthma-related measures we'll be working with for this collaborative, again, these are just the asthma measures. They're not necessarily the PCMH overlaying work, but the asthma measures are ones that are taken from the NHLBI guidelines, and so those are reviewing charts and answering 4 simple questions. You're going to answer these questions via SurveyMonkey, so it'll be very easy for you to answer yes or no based on your 10 charts. So you'll be answering questions related to, did the patient have their asthma severity, risk, and control assessed at the last visit? Was a current action plan composed or reviewed or adjusted as necessary? was the patient and family offered a copy of the asthma action plan, and did the patient receive anticipatory guidance regarding receiving influenza immunization? So again, we're looking for modest improvement from baseline. So over the course of the 4 data collection cycles, we're really looking to see an improvement of 25 to 50% from baseline for each of the measures. Again, there's 4 data collection cycles, and for each cycle, a minimum of 10 charts will be reviewed by each practice and hopefully by each provider. This slide is just giving you what the dates are for the chart reviews. So this is an example of how well organized we are for this particular collaborative. We have a comprehensive timeline and everything's already spelled out, so we'll be easily able to guide you through the process. We won't focus on this slide right now, but we are asking for baseline data entry to be input around March 14th or by March 14th. The last data entry will be October 24th. Again, we'll be doing some data sharing as a collaborative. Another measure we're going to use is the shortened version of the medical home index. It's just a short question. I believe there's 12 questions. We'll ask you to fill that out as a practice at baseline, and we're asking for it to be due March 7th, and then we'll do it again at follow-up to see what kind of improvements you've made. This is a self-assessment survey. It will take you 15 minutes to complete. And then in addition, at the end of each month, we're going to have an online survey. It's going to be in SurveyMonkey, and we're going to ask you a series of questions that are more PCMH related, so we can track your progress with transforming and making yourselves better able to meet the medical home requirements. And this will also help you to prepare for NCQA recognition in the future if you decide that you would like to pursue that.
And this is Scott again. I just want to highlight the monthly medical home tool we'll be asking you to complete, because it may sound like something that is going to take a lot of time. It really won't. And what the beauty of it is that it gives you a good record that you can share with your other practices, and as Kathy mentioned, that you can help use to prepare for NCQA if you choose to go that route, of the types of changes you've made. It really is asking around the different medical home domains, did you take out any tests of change? What were they? How did they work? So it's pretty much basically recording what you did for our benefit, so we can learn that, so we can share that with other practices, but also so you can have a record and really be proud of what you did and learn from it, and be more prepared in the future to be a strong medical home. So quickly, key dates on the screen. Again, we'll send these slides out so you'll have these. We've talked about a lot of these in terms of the due date for the applications, the learning sessions. I do want to make one comment. The learning sessions, we typically would hold those in the Chicago suburbs. We will be looking, of course, at where the practices we enroll fall, but that's probably a good guess, is that they'd be in the Chicago suburbs. We will be able to offer some stipends for travel for practices that might be coming from a far distance. So please don't let that be a barrier if you're outside the Chicago area. We really still do want you to participate. And then just to finish up, we feel like this is a really unique opportunity to be part of a national initiative. The CHIPRA quality demonstration grants have been going on for a few years. Illinois has done some strong work, and this will be a shining star within the project. And I think all the practices who join and enroll will be very proud of their accomplishments and be able to say we've done a lot to improve medical home in Illinois and also improve care for children. It's, as Kathy mentioned quite a few times, we've really planned this carefully. It's very structured. There's lots of tools and resources. It will be a breeze, basically, for practices to join and know what they have to do and follow along. And they'll have substantial facilitation support, both from their assigned facilitator and from us as staff. Participation is free, as we mentioned. There's nothing in this that will cost you other than your time and your commitment, and you'll receive a lot of support. You'll get CME credit, maintenance certification credit for the pediatricians, and then, of course, we are here to help you achieve recognition if that's your ultimate goal. We've done that with quite a few practices, and once we start this process, I think we'll want to hear what your goals are as well, and make sure we are addressing those through the collaborative. And of course, what we're all trying to do is improve care for children and families in the Illinois Medicaid program and elsewhere. And so that's an ultimate goal that we feel like we'll achieve through this collaborative. So the last slide just explains where the link is to apply. We will send this out again. It was also sent out by email. And some contacts for questions, which again, you'll get these slides after the call.
And so now I was going to ask Barb if there's any closing comments you would like to make, and then we're going to open up the call to answer questions that the listeners may have.
Yeah, so I would just say I really think it's a great opportunity, and as one's talking through these slides, it is very structured just the way it has sounded, but I also want to say just the way one's talking about a family-centered medical home, the project then ends up being a practice-centered project. So, you know, different practices, you might be some way along the way to doing some of this for asthma, let's say, and that's not necessarily a reason not to join the collaborative, because then you would be working on other things that you haven't done yet. So I just want to say that it is both structured and there's a lot of assistance, but it also has the flexibility to meet the needs of your practice. And that's certainly what we found with doing the transitioning project, and we're currently doing an NCQA transformation project, and we're finding the same thing there. So I definitely recommend it.
Thank you, Barb. And then this work will also help you in the future to work on medical home as it relates to other chronic conditions or, you know, important conditions like whatever they may be, ADHD, diabetes, and so forth. So now we would like to open the phone lines to see if anybody has questions.
Hi, this is Heather McLaughlin from University Peds in Peoria. Can you hear me?
Yes, Heather. Hi. Sorry, I think we were muted, but we can hear you.
Okay. So I have a quick question about the maintenance of certification, and I apologize for not understanding as you outlined it. So if there's more than one provider practice who's in getting the maintenance of certification credit for this, is it true that they would need to have 10 patients per cycle, or that the practice as a whole would need to have 10 patients per cycle?
Okay, this is Kathy. With regard to your question, again, the MOC is approved right now for pediatricians only. The goal of the project is to have all providers who are doing this for MOC credit to be working off of their patient panel and pulling their own charts for the data collection and reporting. If for some reason during a data collection cycle, a provider cannot get to 10 patients because they have not seen 10 patients with active asthma over the course of the 8 weeks, then we can work with that provider to make sure that they can still get the MOC credit so long as the practice as a whole can produce 10 charts. Does that help explain, Heather?
I could hear you, but yes, that was very helpful. Thank you.
Okay, great. Who has another question?
This is Laura Bianconi from Syntegra Physician Care in McHenry, Illinois. My question is, for the learning sessions, does the whole core team go, or just the lead provider?
Yes, we would like for the whole core team to attend the learning sessions, including the parent partner. We will be able to provide accommodations for teams that are traveling long distances, so we will be able to provide hotel, or for many of you, you'll just be able to drive to and from. For the second learning session, the first learning session is a day and a half. It's going to start Friday or at 3 p.m. to 8 p.m. So if you're traveling a longer distance, you may need to have a hotel overnight. And then we will go Saturday from 8 in the morning until 3 p.m. for the first learning session, May 2 and 3.
Okay.
And so our goal is to have the whole core team come, including the parent partner, but other practice staff are welcome as well, and because we will be offering CME and CEU credit, it may be of interest. So it's the core team plus, essentially.
Okay, thank you.
And again, the learning sessions will be very informative. We'll make sure that they're fast-paced, much faster than what we were able to do with our last learning group for the CHIPRA practices. So I think you're going to get a lot out of it, but actually the biggest benefit is going to be coming together with 20 different practice teams, networking and sharing your experiences. Are there any other questions? Okay, so I think that wraps it up. We did pretty much stay on time. Again, I want to mention, we have 18 people who participated on the call today, and I know some of you represent health systems. So we're able to take 20 practices into the collaborative, and some of the health systems have 5, 6, 7 practices. So if a health system wanted to participate and they all applied, we could fill up pretty quickly and get to 20. So I strongly encourage everybody to complete your online applications. We hope everybody wants to participate. If we go past 20 and we get more than 20, we will have a wait list. And if we see a really strong high demand for this kind of activity, we can look to see what other collaboratives we can do in the future. So everybody, thank you so much for your participation. We really appreciate it, and we look forward to working with you in the future.
Thank you, and this ends the webinar.